In your practice, you see a lot of Indian patients, right? How are they taking more amount of oil without them knowing?
See, one is because of increased food availability.
Yes, you told me. Huh? So by buying outside food.
Buying outside food.
So when you go and eat in a restaurant, of course the oil consumption will be higher because that's where the taste is coming from.
Yes. Second is, what we have noticed in recent past is, we did this observation on one February day, that there were 10 people who came to me on my OPD, and all 10 had treadmill test positive, even though 8 months ago they did not have it. Mm-hmm. Within 8 months they had treadmill test positive, which is indicative of heart disease. It was shocking to me because all of them were my patients. I said, what changed? Then we took a detailed history, spent 2 hours with each and every patient, filled up forms. And then we realized because of winters, they stopped going out. They stopped exercising. Because of environmental pollution, they stopped going out to the parks or health clubs. Because of festivals, they started eating more. They were susceptible individuals. That is why they had come to me in the first place several months ago. They had some problem. They were taking care of themselves. But within 7-8 months, by stopping all this, by just lifestyle changes, they had come out with stress tests positive.
And overconsumption and
decreased exercise, overconsumption because of festivals, because of environment, because in winters we tend to eat more, and also because we tend to go out more. In our house, when the food is cooked for us, it is made to order. It is made, if there are 2 people who are on diet, it is made as per everybody having a balanced diet, including those 2 guys. But if we are going to a restaurant, it is made for people to indulge, which is not bad. I'm not against this restaurant culture or going out. I always feel that being happy is very, very important. Say Nestle Maggi. Nestle Maggi is, I've seen several reels which say it has maida, it has palm oil, it has high carb diet. So you shouldn't consume. It has something which causes cancer. All these campaigns have been run over several years. But many a times I enjoy Maggi with my family because it gives us happiness. It's good taste.
Right. One
Maggi in 2 weeks, or maybe one Maggi, or maybe 2 spoons of Maggi, 4 forks of Maggi. Will it be enough to cause me a heart attack next day or next month? It's about the amount of consumption that we have. We're not promoting it to be had every day, every meal of the day. Well, I'm not saying that.
Right.
But I'm saying that everything is important. Being happy is also very important. Managing stress is very, very important. Sleeping well is important. Why are we only blaming each and everything on the food which somebody has cooked for us, making a lot of effort? My mother, my wife, or our families who cook food for us, why are we only judging those guys and number of teaspoonfuls or tablespoonfuls of oil which is being put, and what oil and what label? Why are we judging only that? Why are we not judging carbohydrates? There are several studies on high carbohydrate diet.
So between carbohydrate and fat, which one as a cardiac surgeon will say that it is bad?
Nothing. I would say anything in balanced diet is not bad.
Which is more excess may cause problems.
So this brings me to a study which I came across. I also have a transcript. I'll just read it again.
Please.
It's an association of fats and carbohydrates intake with cardiovascular disease and mortality in 18 countries from 5 continents. It's called PURE, P-U-R-E study, a prospective cohort study which was published in Lancet. So it was published in Lancet. We consider it across the globe a credible source of information, which would have gone through many checks, peer reviews. People would have studied, and they just don't publish whatever people are saying. They check credibility. This was done over 10 years, 2003 to 2013, not a small period of time. In 18 countries, not a small place.
Correct.
Age group between 35 to 70 years, not a small age group. Population 135,335 people.
Not a small study.
Not a small study. So, and in those, there were 3 high income countries, 11 middle income countries and 4 low income countries. Again, very, very diverse. They concluded that cardiovascular diseases, mortality and morbidity is much more linked to high carbohydrate diet than a moderate fat diet.
Why do you think so?
Over the years, fats have been labeled bad. People tend to avoid them. Carbohydrates give us instant source of energy. And it has not been linked to coronary artery disease or cardiovascular disease. So people say that's okay. They feel it's okay. It's all about feeling. It's all about perception. But several studies have proved this is not right.